Good evening, everybody. Welcome to the Westwood School Committee meeting. Today is Thursday, September 17th. Great to have you all here. I'm going to start by calling this meeting to order. Just almost right on time. Start with roll call attendance. See who's here. Maya Plotkin.
Here.
Charlie Donahue.
Here.
Amanda Phillips.
Here.
Tony Mullen.
Here.
Okay, and all right, great. I'm Carol Lewis. I'm the chair of the committee for those out there in TV land joining us this evening. Welcome to this meeting. Before we get started, we want to recognize that this is a live broadcast and on stream available through Westwood Media Center and also online at westwood.k12.ma.us/live. We are providing real-time public access to the activities of the school committee in accordance with the March 12th, 2020 executive order of Governor Baker. We will have public participation later in this meeting. For those of you who want to participate in that part of the meeting, go to, the directions for this are at westwood.k12.ma.us/live. So this is your opportunity when we get to that point in the agenda. Before we get to the superintendent's report, since I have all the school committee members with me in a so-called room, I just want to take this moment really, to thank you guys. I know we thank the administration and the teachers all the time, and they know how much we appreciate all that they're doing. But you guys, these are crazy times, and I know how much work each and every one of you is doing. We've had a lot of meetings. We have high expectations of your time. You've put in a lot of extra overtime. And I just want you to know how much I appreciate it. And Amanda, I hope you don't rue the day that you pulled your papers last winter. But again, I hope it's okay with you, but appreciate all the work you all are doing. And I think everyone should understand that every time, in these strange times when we're operating virtually, every time we get any of you has gotten a letter or someone has reached out with a concern, you've been great about addressing, or we're discussing it. We've left no stone unturned in this process. And so I just want to say how much I appreciate your commitment. Okay, enough of that. We're going to move on to the superintendent's report. Take it away, Emily Parks.
Great, thanks very much. Good evening, everyone. So the superintendent's report tonight is really focused on fall reopening. So I'll start by welcoming everyone to a new school year and just noting that we have reopened, which feels really good after all of the conversations and preparations that we did over the summer. It was, I have to tell you, really great to see kids arriving at our buildings this week. I was able to get around to schools and say hello. And by and large, I have to say students have been just fantastic. There's a lot of new stuff to learn, a lot of adjustments to make. And they came in, they've been positive, they've been cooperative, and seem excited to be at school. I would also note that parents have been wonderful, have been positive, have been patient. It's been nice to see parents again. I would say that the phase in, which we are in the middle of here, has proven to be helpful. So we are going to be bringing in a new group of students next week who have been learning remotely this week. But we've had a lot of new things to implement, new arrival and dismissal procedures, new routines. And it's been helpful to have some time just to get those things off and running and to work out some of the kinks. The phase-in has allowed us to provide some additional staffing support in grades 2 and 3, which we think has been important this week. So that has been good. I would say that generally we're feeling like things are going fairly well. To be expected, though, there are challenges. So I would not want to say that the picture is entirely rosy. We have had some We've had some bumps along the way, and for all the preparation that you do, when you get into the reality of it, you start to encounter some things that you think, oh, we didn't think that one through. We're going to have to work through
We lost you there for a minute.
that.
I think we're losing you a little bit, Emily.
Hear me now?
We can hear you
How's
now.
that?
That's great. Thank you. Sorry about that. And now we can't.
What am I doing now? I think you're.
You're going in and out. So stand on your left foot. It's we're having some
Emily,
difficult.
maybe turn off your video.
I'm going to turn it over to Steve.
I think.
So here's what I'm going to do. I'm going to.
She says she's turning it over to you, Steve.
That's what I think I heard enough to determine that's what I think she wants me to do. Oh, wait, I think she's going to talk. Okay, she just texted me.
You should
Yep.
do your report, and I'm going to try to get on. I'm going to
Yep.
get onto another network. Okay.
Yep, okay. Yeah, so actually, I think Emily gave a very good introduction because there have been bumps in the road. Technology has certainly seen our share of it. We have deployed between staff and students about 2,000 devices over the last 4 weeks. That's iPads, Chromebooks for staff and students. And in addition to that, we support about another 2,000 devices that are already in the hands of students. So we have had literally a blizzard of like technology, just devices, provisioning, deploying. It's been quite a lot of work. All that being said, we're only waiting on 100 Chromebooks for grade 2. And the speaker microphone units that have been delayed for our classrooms, and the teachers have been coming up with some workarounds there. I'd actually consider us fortunate in that regard in terms of obtaining equipment. I talked about this at the last meeting. There are widespread technology delays pretty much everywhere. There was an article in the Boston Globe today that the Boston Public Schools are waiting on 20,000 Chromebooks. So I don't feel so bad when it's 100 here and it's 20,000 there. So we're doing pretty well there. Yeah, in a normal year, the beginning of the year is always kind of a mad scramble. This year has kind of times 10, really. It's been very intense. And we've had bumps. We've had sound issues on Chromebooks, battery issues, account problems with parents trying to resolve accounts for their little ones, iPads, trying to load apps and things like that. We even had a teacher that lost internet in the middle of a lesson while teaching from home on remote Wednesday. So we've seen everything. You know, we're addressing those issues. We now offer phone and email support. Those supports go directly to the individual school so that we can provide quicker response time. We have our ITCs, instructional technology coaches, are working full steam to real support teachers on more from a pedagogical standpoint. So that's been happening. I'd say, things are hectic, but we're starting to kind of see the light at the end of the tunnel. I honestly think that by this time next week, we'll be in a much better place. We'll have the capacity and the kind of the bandwidth to really address issues in a much more expedient way. I definitely want to acknowledge and bring up the unfortunate Zoom bombing incident that we had at the high school. That was on Tuesday. I will say, thankfully, the teacher did act very quickly. She removed the perpetrators and shut down the meeting. As Emily mentioned in her letter to the district, the teachers are using the waiting room feature to deny admittance unknown users. In this instance, the waiting room was not in use. I have since locked that setting, so nobody can host a meeting without having the waiting room enabled. So they are very aware that they have to be very careful about who gets admitted to a meeting. And we are also starting to require this user authentication thing where only people with a valid, staff or student email address can even get into the meeting. So we started that at the high school. We're rolling it down to the other grades. And when that's fully in place, which I hope will be by the end of next week, I think we have about as secure an environment as we could possibly have. So that's kind of what's been happening in the world of tech. Certainly, if anyone has any questions, please let me know.
Good job, Steve.
Thank you, Steve.
Thank you, Steve.
And a lot of work.
Yeah. Well, we'll get through it. Thank you. I appreciate it. The community has been very supportive and very patient. So I really do appreciate. I've had so much, people just thanking me and the tech department for the work that's been happening, and that really helps. So I appreciate that.
Great. Thank you, Steve.
Yep.
Emily, are you back?
I'm back. I think I have successfully solved my internet problem, mainly by booting my entire family off the internet. So I think we'll be okay now. So thank you, Steve. And I also want to thank Steve for all of his efforts. I want to also thank Steve and Allison and our ITCs and Latifa Frank, our MECO director, many other people who did great work for the 2 weeks leading up to students' arrival in delivering professional development for faculty and staff so that they were ready to implement this technology. And I really appreciate their efforts as well. I want to turn it over to Abby for a couple of minutes to talk about some things in student services. Abby?
Sure. So hi, everybody.
Hi, Abby.
Quick update from student services. So the great news is that in-person services have resumed this week. And so that's a big deal, and we're thrilled about that. And it's heavy lift, but it is in process. So we're very happy about that. So thanks to everybody who's been working so hard to make that happen. Our staffing is almost complete. We are still doing some hiring, so I want to give the committee an update on that situation. I would say that across all job categories, we may have 1 or 2 vacancies, but the area we're continuing to have more than one is the speech and language pathology department. So just very quickly, we have 11 people who fill via full and part-time positions, a variety of speech and language pathologist jobs across the district. And we have been in process to fill or adjust to vacancies in 5 of those 11 positions. So for a small town, a small department, that's a big percentage. We're in pretty good shape right now. We're down to about 1.6 vacancies left, and those 2 schools would be at the elementary level. So secondary is stable, and we're working our way through the elementaries. This is an evolving situation, so I just want to be very upfront and honest to say that we continue to receive requests up through today, and we know they're pending into the future. And our goal is to communicate in writing updates to every single parent by the end of the day tomorrow, so Friday afternoon, so people go into the weekend with a status update. So that would be, is it filled? Is it not filled? If it's not filled, what's the process for that? And what additional services or supports are we putting in place because of this? So broadly speaking, what it looks like is keeping track of any services that are owed, hiring good people, and getting them in. So we certainly apologize to anybody for whom that delay in services is stressful. Totally hear that. And we are working our way through that situation right now. So any questions on anything about student services? Happy to answer them tonight.
Great. Thanks, Abby.
Thank you.
I have two other thank yous. I do want to take a minute to thank the principals, and I feel like I have perhaps not publicly thanked them and praised them enough for their work over this summer. And I want to acknowledge that it was an intense summer with a lot of challenges, and I really appreciate their leadership and their work to make school opening possible. And I feel like I should thank their families too, because I believe that I think I literally canceled some family vacations, and feel like I need to acknowledge that I think it was a lot of people were impacted by the work this summer. So thank you very much to them. And also thanks to Lemma and Ken Aries, our Director of Operations in the Operations Department, because they've done a lot of work around transportation, which is different this year, and our food services, which is different, and HVAC and signage, and it goes on and on. And I especially want to thank Lemma tonight and say that this may be Lemma's last school committee meeting with us before she goes out to have a baby. And so we're very excited for Lemma. A good
Yeah.
escape plan here, Lemma, just
Yes.
when we're getting going. So congratulations to you, and we will miss you, but I will update the committee soon. We think we have found someone who will be a wonderful, experienced business director who can fill in for Lemma while she's out for a couple of months, hopefully enjoying time with her family. So thanks to Lemma.
Thank you.
And if she's still here at the October meeting, where,
Mhm.
well, you'll really be hanging on at that point if you're still
Oh,
here
yeah.
at the October meeting. So
It'll
we'll
be
see.
down to the wire.
That's right.
If it's a virtual meeting though, you can join us from the hospital. It's okay.
You still join
I'd
us.
like to watch. I don't know if I'll be able to join.
Okay, we'll leave that up to you. That's up to your discretion.
Great. Finally, before I turn over to Karen Parita for a minute, I just wanted to piggyback a bit on what Abby had to say about hiring and staffing, because this has been a very unusual summer. Normally our busy hiring season would be in sort of May and June, and that is not at all how things have gone this year. And I think we are in a good place. I mean, Abby mentioned a couple areas that we're still working on, but generally speaking, we are fully staffed, which is not the case in many districts where I'm speaking to some of my colleagues who are having a tough time finding candidates. So we'll talk more specifically about what happened in the hiring process and our staff and the budget picture a little later in the meeting. But I just wanted to follow up with the school committee. I think it was 2 meetings ago that the school committee voted to implement the state's guidance to allow Massachusetts public school educators' children to attend in person 4 days. And you did direct me to see if it were possible to do that without impacting our cohort model. And so I wanted to let you know that I did do that, we were able to accommodate most people, but there were some that we could not. So there were some particular grades and schools where we weren't able to keep the cohort small enough. And so in those cases, I just had to, tell people that we weren't able to accommodate them. But as you may recall, what we talked about was that, there was a sort of an objective, a pragmatic objective to implementing this guidance from the state. And I do want to emphasize that I've gotten a couple of questions that this decision was in no way related to collective bargaining. So this was not part of discussions with our own teachers. We're really talking about Westwood residents who teach in other districts. But it's sort of a reciprocal model where those other districts where our teachers' children attend would extend the same accommodation. And the purpose really was to ensure that school districts would have adequate staff in the school buildings, in classrooms in front of kids. So that was the purpose. And The concern really was that there's a federal law called the Families First Coronavirus Response Act that entitles employees to 12 weeks of paid leave if they have daycare needs, and that would include, if their own children's schools were in a hybrid or remote model. And so clearly, if we had a number of staff invoking the right to that federal leave, that would have a significant detrimental impact for us financially, but also an impact in terms of teaching and learning if we had to hire a bunch of substitutes for 12-week periods to teach our kids. So I did want to get back to you because I know Amanda had some questions about like how many teachers might be taking this leave. And the way that it has shaken out, we actually only have one teacher who has requested this paid leave under that federal law. And so I think that this has been very successful in that sense, because I can only tell you that back in July, that is not the situation that we thought we were going to be in. So we're very lucky. We have people, they're here, they're in the rooms, and I think we're set to go. So I don't know if we had any questions about that and follow up.
What percentage of people that could opt in for 4 days chose that?
That is a good question. I have to say I don't know the number off the top of my head, but I would say a significant percentage.
Okay.
Not everyone, but a significant percentage. And I should also say the people that I called and said or emailed and said I'm sorry we can't do it, we're all very gracious about it. So I appreciate that. And this was for K to 6.
And the cohorts and the cohorts remained within the sizes that we had originally wanted.
Yes. So when there was a situation where that wouldn't be the case, if it would tip it over, then we spoke to the parents in that school and grade level and said we can't do it.
Okay.
Yeah.
And do you have a sense of what percentage of districts on the other side were reciprocal? So, were.
So I don't know the percent statewide, but I can tell you because, clearly from our perspective, it was very important that sort of neighboring districts would be on board because that tends to be where our teachers live, right? And so, I know for sure Medfield, Natick, Needham, Wellesley, Newton, when I looked at the list of where we needed other people to be on board in order to reap the benefit, we were in very good shape there. So the last thing tonight is that we have, for the superintendent's report, we have Karen Parita with us. And Karen is an RN. She was a longtime nurse at Westwood High School, and we have recruited her back here with us. And she is the lead of our COVID-19 monitoring and response team. And this group has been busy over the last month or so. And so I asked Karen just to kind of give us a quick update about the work that they've been doing and where we are at this point, the weekend.
Okay, well, thank you for this opportunity, even to come back and do this job. It's very interesting, and I'm really excited to do it. I've gotten a lot of help from Abby. I have to thank Abby for all her help, and Emily too. It's been great. And Jared's been helpful every time I call Jared with a question. So I work also with Matt Gillis, the athletic director, and Paul Lilla. So we had to sit and create this job. What were we going to do? So we thought our first thing was to have a mission statement. What is our objective? So I'm going to briefly read that. We're here to prevent and respond to potential and actual cases of COVID-19 in the Westwood Public Schools community by providing clear, easy to follow action steps and timelines and facilitating communication for all members of the school community in the event a member becomes symptomatic or test positive for COVID-19. So we kind of went from there, and we've put a lot of resources on the district website under COVID-19 updates that you can see. We have one for a guide for parents, so they'll know what to do. We have guide for staff. We have something explaining what we as a group does, the monitoring and response team. And we put, one of the first things we thought we had to do is educate our staff. There's a lot for them to know, not only about COVID-19, how to prevent it. We had to discuss PPE. What kind do you need? How do you use it? So there was a lot of things we had to educate. So we did that, but we had a slideshow that that I talked over on it, and all the staff listened to that. And we also thought the next people we have to educate are the parents and the students. So we did the same thing with the parents. We put together a little, another slideshow with a voiceover to kind of explain to them what we expect, because we all have to work together. It can't be just the school. It can't be just the parents. We're all together, including our Board of Health. I'm often asking Jared a question. So a lot of what we do is we're consulting with staff members that have questions. It could be a principal, anybody in the school, and we're monitoring the illness in the staff and the students, and we're implementing protocols that we have put together. And we keep a tally every day, and we look over that tally. So for students so far, we've had 13 that we've had to work with illnesses. And there are certain protocols. One student's parent elected not to test them for COVID-19. So there's a protocol for that where they have to quarantine. So that's what that student did. And then we have others that have all had what could be symptoms. We taught the parents what the symptoms might be. And so those parents are calling the school or emailing our COVID team. And so far, all the tests have been negative. We still have a few pending on those students, but so far for the students, they've all been negative. And the parents have been great. They need the support because it's kind of scary for them when their student might have symptoms of COVID-19. So we do a lot of hand-holding and educating and helping them so that they know what to do. And the staff, of course, started 2 weeks before the students. So we have more staff we've been dealing with. We've had 21 staff members that we've dealt with. 2 of them were because they traveled to high-risk states. So they were relatively easy. They had to have a negative test before coming back to school. So they did that. We have 5 that have been in quarantine. 2 of them still are because they were close contacts, meaning somebody that's very close to them, usually somebody they live with, has tested positive for COVID, and they were within the time period where they're considered a close contact. And then we've had 14 that have, like the children, have had possible symptoms, and they've all had to go and get tested. They've all agreed to get tested, and even our quarantine ones have. And so far, everybody has tested negative. I still have 3 that are pending that are very recent, but most of them are negative. And again, for staff, it's kind of scary, but you know, we're educating them and they're understanding why we have to do these protocols. We're being extra cautious because we want to keep our school community safe and open. And the other thing that we've been doing a lot of is consults, and we do a lot of consulting, but we keep a log of those that are kind of, we put a lot of work into these consults. Many of those are close contact questions. We have a lot of them, like my cousin's sister's brother was positive. What does that mean for me? Or my child is sick. What do I do? Do I have to stay home? So it's a lot of teaching for them and figuring out these protocols. I had to call Jared once to check a status of a student who reported to their teacher that their parent had tested positive, but they were cleared. We had one with a language barrier who didn't understand anything. So we had to kind of reach out and teach that parent. And a lot of people are asking about symptoms. Is this a symptom I have to worry about or be tested for? So we're doing a lot of educating. And my job is early in the morning, late at night, whenever people call, so they know what to do the next day. Because the most important thing is we want staff and students to stay home. If they have any questions, it's better to stay home. And they've been doing that. We're getting the word out. And it's really helpful to have this committee rather than each school trying to figure out for themselves what the protocol is, because they keep revising them. I mean, they put the protocols out in July, then they redid them in August. They just redid them September 14th. So we're always looking at changing data and protocols. In this way, we kind of have a look of the whole district at once. And it's been helpful to the school nurses, I think, and principals to have somebody to turn to that's central, that's dealing with this all the time, because they are complicated protocols and they are complicated questions. But so far, I think it's been going well. And like I said, a lot of help from Abby, Emily, and everybody. So I thank everybody for that. Any questions?
Yeah.
Karen,
can I-
go ahead, Tony.
Go ahead, Carol.
No,
You
no.
go ahead, Carol. You go ahead.
You ask your questions. Go ahead.
One's a question, and one's kind of more of a comment. Do you have any sense on testing turnaround time for I know it's early, but
That is a good question. And it can be anywhere from a day to 4 or 5 days. It seems to be, I'd say, maybe 2 days, but then I have the outliers that might be 4 or 5 days. But we're starting to get some that are quicker. So I don't have one answer. Everybody goes to their doctor and what their insurance dictates, that's what kind of test they get, and that's the place they go to. So that's how it's been working so far.
Okay. And you're going to be on for the rest of the meeting? Are you?
I will be here. Yes.
Okay. Well, we'll talk about that topic later.
Okay.
And then do you have a dashboard? I mean, I don't want to create extra work. Is there like a dashboard, like weekly, or like of all this stuff that you're keeping, or like?
I have some daily logs. We call it the docket
Okay.
for all three things. So
I don't want to create extra work. So if there was a dashboard, it'd just be interested to be shared, but I don't want extra work. So.
Well, we're also always updating everything we're doing. We're learning as we go, and we're realizing, oh, people might want to know this or that. So for right now, we're keeping a docket that we improve every day ourselves.
Well, part of it is just, I think it might give comfort if you go and say, you know what, we've had 60 kids with symptoms of, I don't know, a cold or flu or whatever. And, it just may give comfort to people that this is not uncommon. So.
Right. You're right. More information is always better.
Thank you. Thank you.
I have a quick question. Well, first, thank you, Karen, and your team for doing all of this work. I just wondered, are you kind of dictating to families and to staff when they get the test, like on that day 4 or 5 after symptoms?
Well, it really depends. If they're asymptomatic and they're a close contact, they really recommend you wait 4 or 5 days. If they're symptomatic, they don't have to wait that long. So we do try to guide them in when to do the test. We go by what's in the protocol.
Thanks.
Other questions? Karen, all I really wanted to say was thank you for letting us bring you back.
You're
role
welcome.
is incredibly important, and I think you provide the reassurance to all of us to be able to sort of triangulate all the issues up to you and your team. It's so important so that our principals can really do their jobs and not have to feel, and teachers as well, not have to field those calls. So you're taking a huge burden off and taking it onto your own shoulders. So we all really appreciate that. And I want to add, in addition to you being on the call, we thank you for joining us tonight, but also Jared Orsini as our Director of Public Health in town. I mean, we're so dependent on the both of you, really, as we kind of wade through this pandemic. And I know we're going to talk about metrics and testing later on, but we appreciate this partnership that we're forging so that we can do everything we can to keep our kids in the classrooms for as long as we can and avoid the spread of this virus. So that's all I wanted to say on that. Does anyone have any further questions for Karen? Emily?
That is it for the superintendent's report. Thank you.
Okay, so before we move on, that may be the end of your report, but I want to just thank you, Emily, for the letter that you sent out to district parents. This is a tough time for everyone, and I know I made some comments at the last meeting. The letter pertained to student gatherings, captains' practices, and so on and so forth. We know that these are difficult times. With this town is particularly entrenched in sports. I know I'm a parent of kids who were very active in sports, and I know it's difficult, but we really, if we want to be able to keep these schools open, and we don't want to follow Lincoln, Dedham, and Dover in becoming remote high schools, for example, we need to stick to the protocol. Masks up, 6 feet apart. Parents, we need you to get your kids to do this. We can't, or we're not going to get through the season. So this is not intended to be a threat. We all need to work together. And if we don't, it's going to fail. And it's going to be unfortunate because the amount of work, if you think about the amount of work that we've done and then multiply it by 10 times, that's how much work has gone in, at least into this process to ensure that we can get into a hybrid model. There are so many districts out there still struggling who can't get to the hybrid model. And we did it through a lot of blood, sweat, and tears. And if that falls apart because people aren't taking responsibility, well, then it's going to be a very sad ending in terms of where our kids land. We'll have to pivot to remote that other districts have been forced to do. So let's not go there, and let's just keep it up. Masks up, 6 feet apart, follow the protocol, help your kids do so, set an example. That's the end of my lecture, and we will move on. So we move on now to the school committee chair update, my update, and liaison reports. I think my update was just what I said. I'm focused on the protocol, but we're going to move to the building project update. And when I mentioned earlier how much I appreciate all that you all are doing, you know, it's interesting because we're so focused on the pandemic, but there's so many other things that have to continue on. And Maya, nose to the grindstone, moving on this very important building project, turning the floor over to you to give us an update on what's going on with that.
Thanks, Carol. Yeah, so we are continuing to move forward along our process and the MSBA's process. We are currently in the schematic design phase. So we are taking the design that the school building committee selected in June, and we are really starting to flush it out. We're looking at spaces inside. Where do things go? What does the library look like? What does the cafeteria look like in terms of layout? What makes sense? We're also starting to get into a little bit of the aesthetics and the design of the building. And we are doing a fair amount of preliminary investigative work. If you take the trail through the woods by Laura Lane, you may have noticed a few areas where we've been working. We have basically cleared about I don't want to say cleared. We've gone into 2 small areas or 3 small areas right along the trail. We've also sort of created almost a new trail that we needed to get some equipment out further into the site. And also on the northern side of the trail, we've also done another little bit of work there. What we're doing here, just so everybody is aware, is we're doing a lot of geothermal investigative work. Specifically, we are doing test pits and boring. And what those are is a test pit is sort of an opening in the ground, which allows the contractor to review the soil and the underground conditions of the property. A boring is a small hole that's drilled into the ground so you can extract soil and rock samples. And these are both necessary to allow our architects and our engineers to get the information necessary to design and construct the foundation and the drainage systems, and to really make sure we're properly siting the building on the site. So this work is very minimal. You'll see it because it's right off the trail, but it's only about 4 locations, very small areas, and to the extent we're putting in test pits, we are, you know, completely filling them in. They're filled in completely, so there's no danger. You'll also see stakes with flags in them. Those are for engineers so that they can locate where we've put these boring holes. And this is all part of schematic design, trying to figure out where we're going to put the new building. And it's all part of this process. It is not construction. I want to emphasize that. We are not clearing land for construction. This really is investigative work, and I'm in a very preliminary stages and very typical for a project of this size. So that's where we are in terms of the project. The good news is that we have another community forum coming up. I think everyone has missed them. So on October 13th, we are going to be hosting another community forum. It will be virtual, and our architects will join us, and we will give an update of the building and where we are and the changes that have been made to the building since we last showed the community. We'll get into a little bit of the design aesthetics that we're thinking about. We'll certainly talk about what the spacing looks like, the library, the gym, all these decisions that we're sort of moving along with. And most importantly, we really would love resident feedback, as always. We're going to be looking for feedback on the call. We're also going to be looking for feedback after the call. So we encourage everybody to join us. It's October 13th at 7 p.m. We will be sending out a notice, and we'll try and post it as many places as we can, so everyone is aware of it. But it's exciting. The project's moving forward, and I think it's going to be the next few months are going to go quick, and it's going to be exciting. And we're still on track for spring 2021 for the town meeting vote, yay or nay on the project. So that's where we are.
Okay, thanks, Maya. Keep up
Sure.
the good work. We appreciate it. As far as other liaison reports, I think it's still early in the season. Our liaison assignments, unless someone thinks differently, I don't really think we've had anything else to bring up at this point in the agenda, right? Okay. So at this point, we are going to move on to our public participation part of the agenda. This is when members of the public have the opportunity to express comments, concerns, or ask questions pertaining to Westwood Public Schools, the education of the children, and so forth. This is really a listening time for the school committee. We are not required by any stretch to answer questions. We do hear your questions. We do take them into consideration. I want folks to be assured of that, is what I'm trying to say. So for tonight, all public participation will be through Zoom. And again, the instructions to join us are at westwoodk12.ma.us/live. Connor, you're going to moderate this. And I'm going to ask folks again, so important, please give your name and your address. Please limit your comments to 3 minutes, as these days we have a lot of folks with comments. A year ago, we might have had one, but these are different times. So I'm going to ask you to keep your comments to a minimum. And I'll add that if you have written to us and provided your comments that way, understand, again, I'm assuring you that we are seeing them, we are taking them into consideration, so there's not necessarily a need to repeat here at the meeting. That being said, there is a raise hand feature on Zoom located at the bottom right of the window where you will be called upon. Once announced, please wait while the moderator presses a button to allow you to unmute. You will be prompted to unmute yourself, and then you may speak. If you have used your telephone to participate and wish to comment, press *9, and you will be called upon by the last 4 digits of your telephone number. Remember to provide your full name and street address before speaking. Okay, Connor, we ready?
Yep. So the first person I'm going to be unmuting is Donna Morrison.
Hi, Donna.
Hi. First of all, I'd like to thank you all very much for
Donna,
all of
I'm
your
sorry,
hard-
Donna, can you just tell us your street address, please?
I'm sorry, 303 Oak Street.
Thank you.
You're very welcome. I would like to thank you all for your hard work. This has been a very insurmountable thing that you have taken upon yourselves, that you've mastered. My first question, I have 2. The number of cases of COVID that it would take to shut down a school or the district has been danced around but never really addressed. And I was just wondering if you have come to that determination or not. Secondly, Mr. Mullen brought up something that I was going to ask you, and that was a dashboard of cases, because if you go to the town website, that is only updated weekly for the number of COVID cases that are in the town, and it's not updated daily, so that one only knows weekly the status if we're green, yellow, or red. And I think that as a community member, as a grandparent of a student who is going to go or supposed to go hybrid in a couple of weeks, that it would be helpful for me to know what our town looks like. It's a little scary for me to learn that we've been dealing with now 34 people when I did not know that. It would have been nice for me to hear that. And that was a little scary for me to hear that from Karen. So that was all for that I just had to comment on. That I was glad that Mr. Mullen brought it up. That I hope that you really will take that into consideration to put up that dashboard. That I think that would be very helpful. Thank you very much.
Thank you.
At this time, I do not see anybody else with their hand raised in the Zoom call. I do not see anybody calling in with a phone number, but again, there is a raised hand feature at the bottom of the screen, or you can dial *9 if you're on your phone in order to raise your hand. But Madam Chair, at this time, there is nobody with their hand raised.
Okay, I'm going to wait about 30 seconds or so and see if anybody else is coming in, just in case they're having some sort of technological difficulty. So we'll hang on for a bit. Nothing, Connor?
Not that I am seeing, no.
Okay, well, I spoke too soon then, didn't I? I'll just say this, Donna, that if you stay for the remainder of the meeting, that we are going to have some discussion of what we're doing going forward in terms of metrics and looking at the numbers to determine how we proceed with our schools. So it is something, of course, that we are working on. All right. At this point, then, we will close public participation.
There was someone who just joined as you were saying that, who has raised their hand.
Okay.
This person's name is Jackie.
Jackie? Can you give you in terms of metrics and hang on, Jackie. I couldn't hear you. And can you give me your full name and your address, please?
Jackie Keaveney, 22 Redwood Road.
Thank you.
I was wondering, what are the numbers to get us back in school full time? What is the plan? Where do we have to be for the kids to be back?
Okay. Again, that's something that we are working on in terms of metrics and how we pivot and so forth. So we appreciate your asking the question. Are there any other questions out there, Connor?
At this time, no, I do not see any.
Okay. All right. Now I'm going to try again to close public participation. If seeing no further hands raised, we'll move on to our discussion items. Just so you know that we have three discussion items, and we're going to change the order because we have both Karen Parita and Jared Orsini with us, and the first two involve them to some extent. I mean, this is part of our partnership that we're hoping for as we address all these issues pertaining to COVID. So, and then we'll talk about budget last. And at that point, Karen and Jared, if you've had enough and you want to jump off and go running, screaming from the screen, that's okay. But again, appreciate you being here. We're going to start with the public health metrics and monitoring.
All right. Well, thank you all for inviting me. Oh, I have feedback. I don't know why. Is there feedback on your screen? Or can you hear me okay? No? Okay. I have too many things open here. All right. Well, thank you for inviting me. I'm happy to be here and nice to see all of you again. Congratulations on all the hard work. I obviously have been passively observing and giving input all throughout this process, and the amount of effort and the undertaking that you've all endeavored upon has been something to watch, and to see it come to fruition and having our kids back in schools is certainly an achievement you should all be very proud of. So my role in this is to help make sure that all that hard work that you have all put in doesn't kind of just fall to the wayside due to community spread of COVID-19, case counts, clustering, or the rampant spread of the virus within Westwood that would necessitate us sliding backwards into fully remote learning. So the Board of Health and myself have put together a basic benchmark, which we see as a mosaic. So the purpose of our benchmark is really to give us sort of a warning bell when we think we might be inching up to a time when we might be looking at asking the schools to pull back on what they're doing. So there's two different ways to look at it. There's the school side, each individual school sort of is existing as its own entity, and then there's the system as the whole. We have to balance that with what's happening town-wide. So in terms of how people look at questions in terms of whether we're going to close a school or close a system, it's a little bit more nuanced, I think, than to give a number or a metric answer of say, okay, we have 3, we're pulling it down. Well, there are ways to look at each individual number or case count, to look at the epidemiological information that comes from the contact tracing to see if we can rule out really school side risk. Then just because we have a number on our chart that shows so many cases doesn't necessarily translate to there being an increased risk of COVID amongst the school population or the teachers or staff that are in the building. So we have settled on sort of something simple, which I presented to my board the other night, which would be the total case count, which would trigger that red designation in Westwood over 14 days, which would be above 8. That plus a testing percent positivity rate of 4, and that same metric carried over to statewide. So it would be statewide, we're looking at a number of 8, above 8 per 100,000 on a state level, and a testing positivity rate of 4% on the state level. We would say, okay, the macro is telling us we're facing a second wave. Would we choose to ignore that? Then I think those cases do come sort of on our doorstep at a later point in time. So watching the state data gives us a pretty good idea of what we're going to be facing, as well as doing it in the inverse. So, those numbers are what we're looking at in terms of when we would have more direct contact with each individual school and intervene with some different steps to try to get any issues there under control. So, I mean, it's hard to come up with a number or an idea of if you have 1 case, 2 case, 3 case. We would be looking at each individual situation on its own merits and trying to make the most fundamentally sound decisions based on the epidemiological evidence that we have. If that makes sense to everybody. I don't know if you have other questions about how we're looking at it. Right now, I would say relative to different age categories, which we're reporting out, the 0 to 19 group has been among the lowest. And I think one of the differences we're looking at now is we're resuming school with the 6 feet and masking in place, which gives us a whole different footprint or a whole different framework to look at what we were looking at in March when things were sort of spiraling out of control, and we were being advised not to let people wear masks or not to advise people to wear masks. So once that was corrected, I think we were able to sort of, after a lot of locking down and sort of self-protection, we were able to get ourselves under control. And now I think we're in pretty good position to move forward with the idea that we're not going to be 0. But I think we'll be manageable.
Yeah, and on the school side, we're carefully watching, and I know Donna Morrison said it was scary hearing about all those people, but you have to remember we're super cautious in the school setting. None of those people were positive. They were all negative, and that's because we are very cautious, and we've educated our parents and staff to be very cautious about any small symptom. So I mean, I talked to Jared and, obviously would consult with him if cases became positive, but so far they're negative. And when I walk through the schools, including the preschool, they're all wearing their masks. We thought little kids wouldn't be able to. They're all wearing them. The kids are wearing them in school. I hope they do that outside of school, but we are doing the 6 feet and, we are wearing masks.
Right. I think one of the good things about this partnership that we have here is we'll be faster in response by having a communication line set up, in real time. Right. Our data comes to us at the Board of Health, which only reports to us Westwood residents. And if there is a staff member or a teacher who does test positive, that information gets sent to that individual's town of residence. And then it's up to that town to triage, to contact trace, and then notify individuals of their close contact status. So by us being able to work together one-to-one, we can speed up that crucial 24 to 48 hour period where we can then isolate or bring people out and advise them to consult with their physician and maybe obtain a test, so that that person who might be a close contact will be pulled away from the system a day or two before they would have normally been told, and then that might eliminate the possibility of another case coming out of that incident. So I think that the timing, the rapid response will be of utmost importance.
I agree.
So Carol, do you mind if I jump in here?
No, please do.
Great, thanks. So, it's interesting as I reflect on the two comments that we heard, or questions that we heard from the public tonight. I think they're both really important questions, and they're kind of two sides of the same coin, right? So here we are, we decided to open in the hybrid model for lots of reasons that we've discussed. And, I think that there's a question about, well, what would it be that might trigger us to transition to a remote model? That was one question that I heard. And then the other question really is, what's the path back to fully in-person instruction, right? I mean, presumably at some point we will get back to fully in-person instruction. And so I think those are important questions, and something that we really have been talking about. I've been talking about these with Karen, with Jared. I think it's really important that we have a close collaboration and partnership with our public health partners on the municipal side, because of course this is their area of expertise, looking at public health metrics. And I think I'm also hearing a couple of different things. One has to do with what model is the district in, right? So we prepared a reopening plan that allows us to transition as a district between hybrid and remote, or hybrid and in-person. But the second question that I'm hearing is also, could there be a particular issue in a school or in a classroom where we would have to make a decision for a smaller subset of the district? And I think that is possible as well. And we tried to address those kinds of things in some of our reopening protocols. And I do think that some of those situations clearly would involve assessing a particular situation, applying some judgment, consulting, thinking about the specifics. The bigger question, though, about the district model, I think is one that we really need to talk about as a school committee, and in consultation with the public health department. And so I sort of presented a possible draft just as a basis of discussion, if the committee is interested in taking a look at it. It's something that I put together, and it's based on some things that I've learned in my conversations with other superintendents, based on also reading many of the guidance documents that we've been immersed in this summer. And I've consulted with Jared and also with Karen. And so I'll share my screen here. I don't think that I don't know that it's perfect, but I thought it might just be good for us to have a starting point to talk about. Is that big enough on the screen, or should I zoom in a little? You can make it a little bigger. Make it a little bigger.
I think it's good.
Good. Okay. Yeah, actually, I think it's good if you can see the whole thing. So, should I just walk you through what I have here?
Yeah,
go ahead. Okay. So really, what we've been talking about is what are the metrics that we should be monitoring, say on a weekly basis, in order to assess what model the district is in. And so we were thinking about what would those metrics be, and then the second part is having identified what metrics are the right ones to be looking at, then what are the associated thresholds for each of those metrics that would sort of signal something about the model that we're in. And so this is just a mock-up here, and this is actually using the most recent data that came out from the state Department of Public Health. And so on the top here, we just have some statistics for this week in Westwood. So the color classification here this week, based on the state's color classification system, is green. That was actually a positive change for us because the prior 3 weeks, I believe, we were yellow. Our 14-day cases is 5. Westwood's percent positivity over the last 14 days is 0.61%. That also was an improvement over last week. And here's the state's percent positivity. So that's just sort of the overall big picture. And then what we have here on the left in gray are some possible criteria that we could look at. So in what I've referred to here as the metric matrix, like, well, what should we look at? So my understanding from speaking with Jared and others in public health is that this is a metric that people are very interested in, the number of confirmed cases per 100,000. And so, you know, Jared mentioned here that a threshold for him is 8, sort of 8 or above would indicate that probably fully remote is where we should be, between 2 and 7.99 hybrid, and 0 to 0.99 fully in person. And then we would also be looking at Westwood's positivity rate. And again, here are some possible thresholds. We just heard Jared say that sort of above 4% he thinks would be cause for concern. And then also we want to look at this bigger picture about the state's positivity rate. And Jared, I don't know if you want to say a word or two about that. I mean, you know, obviously we're very interested in Westwood. Then again, we have faculty and staff who come from, you know, many other communities. And I wonder, is it just the big picture trend also something that you think we should be keeping our eye on here in Westwood? I know, Jared, if you have any thoughts about that, sort of like what would be the value of looking at the state percent?
Right. I mean, yeah, I mean, that I mentioned that too, is, you know, is trying to have the the macro and the micro,
yeah,
so that we are able to sort of see if cases are coming at us. You know, a lot of the new map that the state has put out with the color coded designation sort of laid out on the map, you can see them move. Like when we were yellow, our neighboring communities were also yellow. We've shifted back, you know, then one of our neighboring communities shifted to red. So over the next 2-3 weeks, what we need to watch, say, is that red shift from that community going to come closer to where the other communities were yellow? Because everyone, like I said in my meetings, which is important for all of us to realize, is we don't live the entirety of our lives inside of Westwood boundaries. That Norwood, Dedham, you know, Westwood, Medfield, Needham, you know, we're all constantly moving in and out of these places, you know, especially for work and, you know, for school and for shopping and entertainment and all of these things. So what happens in one neighborhood or one community definitely has the ability to reach into ours. So I think, you know, you need to have both perspectives as you start to try to look at this data, and be able to interpret it and decide how that's going to drive your action or your plan.
Okay, great, thanks. So
when we were yellow the last couple of weeks, none of the towns we compete with academically were yellow.
Yeah. Okay. So I think that, you know, the idea here is that we sort of have like a criteria matrix that we could take a look at, and you know, and there may be other contextual factors, but this is sort of a starting point. And then similarly, DESE has established what they call their learning model expectations, and this is related to that color coding system. here, and they have, you know, correlated it with what they think the model should be, right? So if you're red, it's remote. If it's yellow, it's hybrid or remote. If it's green, it's hybrid or full in person, or I think this is actually white on their designation, not gray. So these would be two possible kind of metrics, you know, matrices to look at. Over here, this part of the dashboard, if you will, then provides the weekly data that we could apply to these matrices. And in addition, something that I thought we might want to look at is not just the total number of cases, but also the breakdown of the cases by certain age spans. And I think that's potentially an important contextual factor. So obviously, if you know, for instance, if there were a spike in cases, but it was, you know, confined to the elderly population, we might think of that differently from if we saw a spike in cases of school age kids in terms of our decision making. And in speaking with Jared, you know, though this is not something that's part of the state's report, this is data that, you know, he has and you know, could share with us. The other piece on this page is just recognizing that we are part of an athletic league, the Tri-Valley, and the decision this year in the league was to keep districts in sort of like pods, competitive pods. And so these are the 5 districts that our athletes would be competing against. And so I thought that it might be important for us to be taking a look at what's happening in those communities in order to decide, say, on a week-to-week basis, whether or not we're comfortable having our students play that team. And so that seemed like an important measure to look at as well. And so sort of with like the criteria and then also with the data, then the idea here would be that we try to apply it and in a given week do some analysis. And so again, kind of, you know, fill in where we are. And then these are, again, this is just a draft, it's open for discussion, but some other things, you know, I've been reading some of the school reopening benchmarks from, say, Rhode Island, which has done a lot of work here. And here are some of the questions that they also suggest that districts should be asking themselves. So something about testing readiness. Do we have the ability to test all symptomatic staff and students and on average get results within 48 to 72 hours? Because, you know, that's an important part of the health and safety protocols that we have in place right now. Supply readiness. Does every school have more than sufficient cleaning supplies, soap, hand sanitizer, and PPE? You know, thankfully, we would answer yes to that today. If there were a situation where the answer to that were no, then that would be important for us to consider. And then our ability to implement preventative guidance. So questions like, can each school or classroom meet public health guidance around physical distancing during transportation to and from school, classroom learning, and other times of day, such as lunch? Sort of yes, no, where are we on that? And, you know, I heard Jared use the word mosaic. That kind of resonates with me, right? So we would have a lot of pieces here to look at, and then there has to be some way to say, okay, and you know, what do we make of that? So we kind of use those matrices, we have the answer to those questions, there may be some important context, and then, you know, we have to make a decision about whether or not the model remains, or if there's a transition to some other model. And for athletics, again, we may have to make a decision from week to week about whether or not we played a team, right? So for example, in this, you know, hypothetical scenario here, because we don't actually have any games this week, but, you know, Dedham was red. And so we might say, okay, well, we wouldn't play Dedham this week, for example. This I put up here just because for DESI's learning model, they really emphasize that you need to be looking for some trends over time, that you don't kind of want to react, you know, based on one change. And they suggest that you look at least 3 weeks worth of data to be looking for trends before making decisions. So as I say, this was just sort of a first pass
at trying to think about how to think about this. This is a basis for conversation.
Thank you, Emily, for doing this. And could you send a copy of that out to us so we could look at it?
Yeah. Oh, sure. It's linked in your agenda, but I will share it with you. Absolutely. Yeah.
So I think a key point in all this is the words you used, contextual factors. And so it's not necessarily black and white. We really have to look at specific scenarios. So for example, if we had a spike in the number of cases, but let's say they all occurred, say that we had 5 in one particular household, that's something we consider, correct? I mean, it's not that we say, all right, well, we've increased this number of cases. I mean, there are a lot of different factors, and I guess it goes back to Jared's point, the mosaic. There are a lot of factors we have to look at before we decide to pivot or close a particular school or something like that, correct?
Right. The tracing piece becomes the most important part of this. Is we try to figure out, who has been in contact with a particular case, and if it's confined to a household, and in interviews with those household members, there's information that comes out that a particular member of that household was on a camping trip, maybe, or on a fishing trip, or somewhere else with 8 or 9 students from a particular school. Like all of those, all of that epidemiological sort of investigative information becomes part of our rationale into what we believe the risk is. So those are important factors. For our piece of it is that second part of the DESE talking point is the code with the color for the number of cases per 100,000, but also consider any other factors the Board of Health is able to identify during the course of their contact tracing. And I think that is a big part of this. One of the things is, in the last 2 weeks, Westwood residents have been administered almost 1,000 COVID-19 tests. I mean, most people get only one. Obviously, some people get more than one. So you want to think somewhere around 900 people were tested for COVID in the last 2 weeks, and only 6 have turned positive. So to go back to what Karen said sort of at the beginning, is having that number saying I had 14 or I had 30 people who called me saying they woke up with a congestion or runny nose or sniffle. A lot of the vast majority of those people will end up not being ill from COVID. It'll be something else. So I think that's one of those contextual factors that we try to tease out during our investigation.
Yeah, so I guess I have a few comments. So I just want to build on kind of Carol and Gerald, and I have a few particular comments. So I think that's exactly right. I think, and well, Charlie and I have talked a little bit about what we've learned, but Wellesley actually went back and looked at school nurse data from like last year, so before COVID. And I don't remember the exact number. I think they said 1 in 90 per day or week, kids had symptoms that you could say looked like COVID symptoms. So just to put that in Westwood context, that would be 35 kids a week, let's say. And it gets to my point around Karen when she said there's been whatever the number was of kids, but that's going to be normal. Normally kids will have some symptoms that might be associated with that. So I think that's just important for the community to understand. The other couple, so more specific points on this, I think we really need ahead of this a little bit of the context. So like, I worry about putting a number full in person of whatever it is, whatever the number is, because we could flip there. We could be there in 2 weeks. And if we put that number out there, I just am a little bit worried that we should need a bit of context about the overall public health situation, where we are in vaccines, where we are in treatments, because these things could flip, they could flip red, they could flip green. And I think there needs to be a little bit of context, kind of written out, like kind of some of the stuff you've been talking about, Carol, Gerald, Emily, because I think that'd be important as we communicate to the community, because there's a broader context. And then the other 2 points, as I've thought about this, my initial comment, I really think, I don't want to create a lot of extra work. I think it would be helpful to have some of our internal data tracked. So some of the stuff Karen was talking about, I think it would be important because it will help us spot, I think, trends as we get into flu season and maybe other, other non-COVID related, and we'll be able to look and see what's going on really among the community and among our children. Again, I don't want to create work, but if it's easy to kind of track how many, children we are out for getting tested and some of that, I think it actually would be additional data beyond the public context. And my final point is I don't think 48 to 72 hours is an acceptable metric for testing. I think we need to find a way to get to 24 hours from the time somebody goes to their doctor, that they can get a test in 24 hours. That's what Wellesley's committing to, and I think we need to find a way to find some partnerships to get faster testing for both, not just the children, but for the staff as well.
Jared, is there any sort of town-wide advisory group with respect to specifically COVID? I know that other towns have created those. I wasn't sure if Westwood is discussing that, where you've got stakeholders from the school, from the select board, from the Board of Health, from any sort of, I think the more collated of an effort within the town that we can have, the better. And I feel like, we've put this up there, and I know, Jared, you've definitely had input in on it, but it seems like the school is kind of saying, this is what the public health metrics for the town of Westwood, or at least for the children and the teachers in the town of Westwood, should be like. And I just feel like it just seems that we need some sort of more collated effort. So if there is discussion of having some sort of town advisory committee, I just don't know if those discussions are being had.
So you go ahead, Emily.
Well, no, I was going to jump in to say, mock-up that I presented is like, this is a concept. We would have something like this where we're looking. And so I do want to be clear. I wasn't necessarily suggesting, to Tony's point, that like, I threw up that question. I don't know that I would say 48 to 72 hours is acceptable either, right? So the thresholds, they're really, it's sort of the concept. And I think this is getting to Maya's point that, some people with some expertise really need to weigh in on some of these.
Yeah, and if we have, I'm sure we have people in this town who have the epidemiology expertise we need, who, and bringing in someone from the select board and someone from Jared, you or your office. I just think that if we can get everybody in the same page, or in the same room, to sort of sort some of these issues out, it seems to me that it's better than the school committee. I'm not an epidemiologist, I'm not in the medical field. And I just think that if we can get somebody, get the right people in the room to kind of all be collated on these issues, it makes a lot more sense to me.
Great.
We have been talking about that. So I don't know, Carol, if you want to talk about what we've.
Yeah.
So
we've had just that conversation, Maya, and we made the very same point that we as school committee members don't have the expertise in this area. So what we are looking to do right now is to formulate an advisory group, an advisory committee, if you will, and it would consist of representation, Jared, for example, from the Westwood, Director of Westwood Health, and hopefully a member from the Board of Health, as well as a liaison from the school committee, Emily, Karen, our school doctor. And so this is the group we're looking at right now, to basically review the metrics and on a regular basis, and provide us with the advice, advise us basically. So that's what we're looking at. So it's almost like you're a plant, Maya, because that's exactly what we're talking about. It's so important. We cannot, as a school committee, just decide on our own. We really need experts like Karen and Jared and our school doctor and others to advise us. And then, we make the decision, but we know that we can rely, we have solid input.
I think it's twofold too. Step one is to really, get some people, some expertise to look at it and to try to articulate, like, what are the metrics that we should be looking at? And I think have some agreement that that's, okay, this is, how we want to approach it. And then, the second piece is to have an advisory group that then can monitor them.
Right.
Periodically. And, and provide information to the school department, to the school committee about sort of how are we doing on these things that we established. And because ultimately, of course, it's, the school committee's decision about what model we're in. So, so that's what I imagine, that we need to get some things established, and then we also have the monitoring process afterwards.
Yeah.
So
Go ahead, Jared.
So one of the issues is we're relying on data being produced, by the state, by the Mass Department of Public Health. So, we don't have an epidemiological arm over here at the Westwood Board of Health. However, I would love one. But, the data we're relying on is being provided by the state, which is being collected by the individual testing sites and healthcare providers that our residents are seeking out. So that is one of the challenges for us to have. There is more data out there. It's just not being collected and it's not being shared. It's better now than it was at the beginning. At the beginning, we were very reluctant to trust the information that was coming out because none of the information, when you put it all together, seemed to make a lot of sense. And we didn't want to give people a false sense that our numbers were so low that they didn't need to follow the guidelines. And we didn't want to give them the sense that our numbers were so high they needed to lock themselves in their houses. It was this push and pull. So I'd be interested in seeking out, additional data to help build on this picture that the state is giving us. The percent positivity and the case counts. They made this 100,000 metric to sort of smooth things out amongst different towns with varied populations, especially when you try to compare a city, next to a smaller town. So, they wanted to make sure it didn't make one town, kind of way up on the scale and another one lower based on their population. So I think there's a lot of wiggle in that per 100,000 number from what I've seen over the last few months of watching it. And our number went, from 1.7 to like 5.6 in a span of about 8 days. And then it went back to 5.3. Now it's back down to 2.4, the lowest it's been in a month. So to just look at that as, sort of the canary in the coal mine of how we're doing doesn't really give us the picture, because just one spike or one cluster or one super spreader event is going to throw that number way off kilter. And it'll take multiple weeks of a low report to bring it back down. Just for an example, the last 7 days, we had 0 cases, which is great. But what are we going to look at in 5 days? The Labor Day holiday is about 11 days from behind us. So we still have 2 to 3 more days where we're looking at cases that may come in if people were maybe lapsing in their judgment over that weekend. So getting more data, I'm all for it.
I have just a couple comments. First, Emily, thank you so much for putting this together. I think it's a great jumping off point for all of us. I'm thrilled that we're going to be able to add the ages for context purposes. I'm wondering about trending. DESE obviously uses 3 weeks, which Tony kind of touched on. It seems like we could potentially be jumping back and forth, right? That doesn't make a lot of sense. So what we're thinking about in terms of trends, what would be acceptable for the community? And then I'm also wondering, once we have that data and potentially this advisory group, if we could like carve out certain trends we're seeing. So for example, if we're, we see there's an outbreak a few weeks in a row at the senior living community over on University Ave, could we potentially set that aside and say, okay, yeah, our Westwood might be yellow, but as far as the schools are concerned, we really feel we're green because that's not impacting the schools. Again, the medical experts would likely have to weigh in on that, but just wondering if that's something we could potentially look at.
Yeah, that's built in into what we're, what our office is planning to do or we have done on the townwide on a larger scale. So, it is definitely in most of our conversations. So it's an easy jump over to the school side. I'm curious and wonder always, what the residents of the town are looking at in terms of a system or a plan. Like I imagine that most of the people are concerned with the children in school over those particular schools. So one elementary school versus another. And my view of this is that like I said at the beginning, each individual school needs to be treated as its own sort of entity, insofar as they're able to control any cases or any issues at those schools. Adding in siblings or family members who are staff or teachers in other schools, that those things need to be considered. But we don't want to necessarily, if we pull one group or one grade or one school out of hybrid in person to fully remote, that necessarily shouldn't knock all the dominoes over for every school in the district. And I think that's important for us to be able to work through together to make sure we're on the same page there.
Okay, so I think that we should focus on getting our committee together. And I know that Tony, you indicated that you might be interested in being the liaison to this committee.
Yes.
Okay, so that would be great. So I think in the next few days, we're going to pull together this committee, and the committee can have some discussion on metrics, and that's our starting point, and we go from there. So number one, we got to form the committee, and number two, let's start working on figuring out what our metrics are and how we're going to proceed. How's that sound?
Carol,
okay?
I'm sorry, could you repeat who at least initially you thought would be on this committee?
Yeah, so Emily, now Tony, our school doctor, Jared, Karen. We haven't formed it, but this is what's in our minds. Who am I missing, Emily? You're on mute.
If there were someone from the Board of Health who was interested and willing, then that would be a very helpful perspective, I think.
Right, and what we anticipate too is those, I know we have a lot of experts in the town. We have all kinds of professionals in town, but this is the committee that, this is the beehive, and they do their research and they can speak to their experts and so on, and then have their discussion. I don't want the committee to get, in my head, I don't want it to be too expansive, because then we will not get anywhere. But that's where we thought those were the people we thought would be the most effective in the specific committee, the actual committee.
Okay. The only thing I would say is we might want to think about including someone in infectious diseases.
Right.
Because it does seem, I know we have a school doctor, but I think that someone specific to this field, and whether that's someone, that is associated with the Board of Health, or I don't know how we define that person, but I do think it's important to have that background.
So an epidemiologist or a virologist, right?
Yeah, so I would just encourage the committee to look for that person to fill that role as well.
Yeah, I would absolutely love to see an epidemiologist. We don't have one on staff, so it would be tremendously useful.
Anyone else, Jared? Anyone else? Any other profile you'd find useful?
The epi for me is the big one. Obviously infectious disease or even pediatrics would probably be relevant, especially with sort of this creeping data about long-term health effects on school-age children that might be infected with COVID. Those reports are still sort of not completely verified or substantiated, but they're definitely out there and they're worthy of at least consideration. So yeah, somebody with a pediatric background and an epidemiologist, I think would be worthy additions to any group.
Is our school doctor, I'm assuming, is our pediatrician. Okay. So that there we have that for sure.
Yeah, he's definitely an expert in pediatrics.
Okay.
But I think I'm just getting it. I think it's important. How do I say this? I don't want this group to be seen as too insular. So I think it's important to have, if we have an epidemiologist or someone who's appropriate pediatrics in the community, I think we would be well advised, at least my guidance, to include them as this committee. Is at least my view.
Okay. Yeah, no, I think that's a good point. I just, I would have no objection to that. I think that's important. I just, I have nothing else to say on that. No, it's a great point. Any
Okay.
other comments on this before we move on to our next discussion item on the COVID testing working group? All right, so let's move on. Thank you, Jared, for your input on that. And we're just going to jump to the next item. So Charlie and Tony, you were charged with, as the working group for COVID-19 testing. I know you've done a lot of research. You've spoken with a lot of folks. And so you've got the floor.
I think Charlie's going to lead off.
Okay.
Well, I will, first of all, just going to summarize the great help we received from the town of Wellesley. They're about 6 months ahead of us in thinking about this, and it's because they had a scientific advisory committee of citizens, 4 physicians in infectious diseases, epidemiology at Boston teaching hospitals, and a PhD from the Broad Institute, the Harvard MIT Center for Research in Life Sciences. And they had citizens sat down and put together their paper, which each of you should have received. Then the school committee decided to take this issue seriously based on their advice and set up a committee. You've received the webinar that was given to all the citizens of Wellesley by the Wellesley Educational Foundation. You've received the report from them. They've committed $250,000 to get into a COVID study, the frequently asked questions. You've got the minutes of their meetings. You did not get the 50-page RFP that they put out that they've decided this week to proceed with testing of all of their teachers and kids based on the responses from the RFP, and you did not get their dashboard that they're working with. Tony and I had a 1-hour meeting with the chairman of the school committee, Linda Chow of Wellesley, and Jesse Baum, who's the chair of the scientific advisory committee, and we had a very nice 1-hour discussion with them. And I spent last night for 2 hours on a collaborative group they put together that had 43 people on the Zoom call from 7 school system superintendents, health departments, research units, 6 people from the Broad Institute, all discussing where they are, what they're doing. The objective of all of these people is to keep their hybrid model in place and not go back as Dedham did from hybrid back to in-home learning, because they exploded into becoming a red town. So their concern is to keep kids in school and expand from 2 days to 3 days to 5. That's the objective of all 43 people at the meeting. And they've come up with a design to do that. They basically, of the objectives, you've received them, I sent them out to you, which is to immediately test anybody that has symptoms of COVID as soon as possible within 24 hours. Newton Wellesley Hospital will give the students and teachers of Wellesley a 24-hour turnaround. So the physicians just call them up and do it. Tony and I have started an investigation of who could do that for Westwood people. Can the Dedham Medical Associates, could Harvard Medical. So there's people willing to do that. Can we help the parents and the students and the teachers find somebody doing a fast turnabout? Because the concern of all of these groups, if they don't test people that have symptoms soon, they may be putting themselves out of action. They may be, teachers may be staying home who could be teaching if they found out they're negative in 24 hours. So we're doing that. I think there's an excellent discussion tonight. Karen and Jared have started getting our people tested as soon as they have symptoms. And Tony mentioned the numbers of kids coming in. The second concern they have over there is 40% of the people that are COVID positive, teachers and students, don't know they have it, they're healthy, they're infective, and they can infect other people who can go downhill, get sick, and die. So the concern why they're testing kids and teachers is a lot of the infected people don't know that. So that's why they're going to be getting into doing all of their testing. The second objective is to test all teachers and all students before they enter school. They're doing that right now. How do they do that? That's what the RFP asked for. The state of the art today is you can do it in 24 hours. You can hire people to do it. They have a variety of different tests now that are very fast to do. The low nose, and then they can do tests by the students spitting into tubes. So the third thing they want to do is to, after testing all students and teachers before they come in, is to test all the teachers every week. Ideally, they'd like to test all the kids every week for a few weeks, if that's possible, and they can afford it. They're now looking at the financing. How do they pay for it? The Wellesley Educational Foundation has committed $250,000. The Wellesley Educational Foundation sent out a survey to families. 94% said they'd be willing to contribute money themselves to get this done. And they have come up with pledges of $750,000. The estimate for the pilot is $1,500,000 to get started and to do it. So that's a quick summary. The call that I was on for 2 hours last night, this collaborative group has health commissioners from the towns and the cities, school committee people, superintendents. It's an excellent meeting that gets together, sharing what each town is doing, where they are, and what they can learn from each other. We already have an RFP 50-page that they already did that we could look at. So there's an awful lot. But the bottom line is everything that you've said tonight, it makes sense. What we're doing right now makes sense. The question is, and the worries that all of these groups have, is that there's still a very good chance that we could have enough disease among kids and teachers that we have to cut back on our initial plan to have kids in school for 2 days. It's a possibility coming up in the next few months that possibly could end. And if you want to do everything possible to continue expanding the in-school teaching, we've got to find out very carefully everybody that has it and find out how they got it, who they've given it to, and the testing that they have designed and are actually implementing in Wellesley right this week is a possibility. So that's a quick run through. We have a lot of information they've given to us that we could share with people. But I think the scientific advisory group in Wellesley, it started off, these are people who are just at the cutting edge of where the science is, and they're working with the health department. They're working with other groups within the community on that. But that's the committee, and a committee like that have offered the epidemiology, the infectious disease people to give us state of the art of what's going on would be valuable to draw on. The committee that's been discussed tonight makes great sense to have a committee like that that deals with the medical issues. It supports our own nurse who's going to be working on this. I think, Karen, it's great to have you back, and Jared to support you. The second thing they have over there is an operational committee, the committee that sits down and says, who writes the RFP? How do we implement it? We have a tent at the high school one day. The next day it's at the middle school. The next day it's at the teachers come out, the kids. How do you operationalize this? The contract that you hire does a lot of that for you, in addition to reporting the statistics to the health department, the local town health department. So there's already companies out there ready to do this for school systems. They've been doing it for the colleges for quite some time. So if anybody has an interest in the ultimate goal, so that come November, December, we're humming along, maybe having a 3-day week or a 5-day week. I respect this group for what they've done more than anything I've seen, as far as they've got their act together. They've figured out how to do it, and they're working on this daily, coming up with every little issue and problem. And the schools that they're dealing with are as progressive as Newton and Brookline and Cambridge, and as red as Revere in Chelsea. So that they're dealing with it across the board, red cities and towns, as well as cities and towns that don't. So they're really looking at what the state of the art is to test, find out, and what can you do. So Tony and I would be happy to follow up on anything we've learned. But this foundation, it's not a foundation, it's an advisory group that they set up that meets once a week. They invited us to be on the call last night, and it was an excellent group to learn something from, as far as people interested in going in this direction. Happy to answer any questions.
Yeah, so let me just
So-
add a couple things.
Yeah, did you want to jump in and then we'll take
Yeah.
questions after?
So
Okay.
yeah, let me just add, I think Charlie gave a good overview. I guess 2 other things I do want to highlight that I thought for me were ahas. One is, it's this kind of second bullet around what you call testing. And they made a good point of this with our friends in Wellesley. So there's kind of what you might call the last one, the assurance testing, which is, what the sports leagues are doing or some companies are doing, where you test, people once a week, right? And that's, I think Charlie's talked a little bit about that, and that, that takes, that has its value, but it takes obviously some time and money to set up. But I think the other couple things that, and I think we talked a little bit about this earlier, and I know it goes back to a little bit of the July, ABA, when we had that positive COVID with the ABA, is, they said separate that from like testing turnaround, which is, how can we quickly get staff members or, students, tested, right? Because we're going to have, to Karen's point, we're going to have, whatever the number is, 35 children a week, 10 staff members, and to the fact that you can get those tests back, in 24 hours compared to 2 days, compared to a week or 5 days, it makes a big difference. And I think Jared could probably speak more to that. So I think, and they've got it in Wellesley put together, has an agreement with Newton Wellesley as an example. So I think that might be a short, quick win that I thought was, given it could be really positive. And I think similar to that is actually thinking about if you did have, to Jared's point, if you had an outbreak at a school, could we have a similar arrangement where we could get, 300 students and, 10 staff, 25 staff members tested in a similar period. So I think that's separating that a bit from the assurance testing, I think is, to me, it was actually an insight because you might be able to move on the first before you kind of get to the assurance testing. And the other thing, I think my other, comment, I think you see some of the recommendations. I think we've talked about in advisory groups. I think that's already underway. I think the other piece, and this kind of gets to, I think, what the advisory group may be able to kind of weigh in on, is that this, like COVID, again, I'm not, as Maya says, I'm not an expert, but the testing environment is rapidly changing. So I think to the extent that this advisory group or healthcare task force could kind of weigh in on what's state of the art testing, because we may have saliva tests in, by November or whatever the case may be. There may be the testing is rapidly evolving. So that would be another point I think came across. I think we look to this advisory group to kind of weigh in on, because that may change how we think about some of this as well.
Yeah. No, thank you both for this report. It's extremely informative, and I think you're right. I think this advisory group could play a tremendous role in helping us address this issue, and whether it's something that we can pursue. So here, I just have a specific question though. In Wellesley, did they require that every student get tested before they went into school the first day?
They don't require the teachers or students, they don't require it, but they advise that they all do it, and they make available to them the group testing. And they also, a couple of towns like Brookline is looking into testing town employees, not just, when they get the system in place, they're looking into that as an option, but it's not a requirement that you have to be tested.
I think, I think in Wellesley, legally you can't force the kids. They were encouraging. I think they said, I'd have to go back, that at least for the initial test, the unit had agreed to kind of have all the staff tested as part of the initial kind of round of testing, but I don't think you can require the students to do it.
So I think I liked your point too about, for those who have symptoms or whatever, to be able to get in and get tested right away. What do you call it? The assurance testing is tremendous, because then we won't be, I think we can allay a lot of concerns very, very quickly. For those who have, coughs or colds, that's really all that they have. We could address that hopefully within 24 hours. And it sounds like Wellesley has a tremendous partnership with the Newton Wellesley Hospital. But where would we go with that? Every school can't go to Newton Wellesley, because then they wouldn't be able to follow through on the 24-hour.
Yeah, we don't know. I guess we don't know, but I think it's worthwhile pursuing, I guess, is the
First, you go to your physician and you tell your physician, I think I need this test done. I'm feeling that. The new Mass General Brigham urgent care facility down by the train station in Westwood is willing to bring people in. They send it into Mass General Brigham at night. They'll give you 24, but for contract purposes, they say 48 hours. But to let local physicians know, they can make a call there and get something faster than what they're used to. So I think what we could do is find places willing to give the doctors of our kids. Now, if somebody's uninsured, that's another issue. But if you're insured and you have a doctor, there's places like that. Atrius Healthcare, which has sites in Norwood and in Dedham, we can make some calls. So you can make some calls so the physicians can call in and know that's where they can get their kid or their teacher who's a patient in for a fast 24-hour test.
Yeah, when I read through the materials, I was interested to see that the Wellesley Scientific Advisory Committee, they had kind of established their priorities. And as I recall, that was the first priority that they had identified, was this quick turnaround testing for people who are symptomatic. And that really caught my attention. As you said, Tony, we experienced that back in July, and that was, the turnaround time was nowhere near 24 hours then. And that really impacted us. And, so we do have this docket where we are collecting that data you mentioned. And we already saw that. I mean, even in the first 2 weeks for teachers, we had a number of teachers who, for various reasons, but symptoms being one of them, needed to go get tested according to the protocol and get that negative test before they could come back. And 24 hours, that was rare. It was taking, longer than that. And what I was thinking was, well, we can handle this now because we don't have any kids here, right? But if we needed the teacher in the room and they were waiting, 5 days for a test result, that would really be, a very negative impact for us. And so the ability to quickly get on it seems very important if we're able to make that happen.
And if we have any interest,
Can I say one thing about the testing too? Some of our teachers or kids are getting fairly quick testing, but our protocol also states that they have to be symptom-free for 24 hours. Like they can test negative and they also have to be symptom-free for 24 hours. So they can't always get back that second they get the test.
Right.
And if they're quarantined because they're a close contact, even if their test is negative, they still have to do the full 14-day quarantine. So there are some rules around that fast testing won't help. It would for assurance testing, but not always if you're sick.
Right.
I just want to make
And
that.
those are DESE guidelines. That's the stop-start protocol that DESE put out.
Yes.
Yeah.
But but maybe just play the other. So if you had to wait 6 days, you'd still have to wait the 24 hours, right?
Well,
Am I wrong or not? Yeah.
If you're tested, say you had it turns out to be a simple cold. Well, we've had a couple of kids that have vomited, but just once. And if they got the test, they had to be not vomit for 24 hours. So those kids, essentially, when the test came back, they could go back to school. But if somebody had something that the illness lasted longer, they had the negative test and they also had to wait 24 hours with no symptoms. That's what the guideline states.
Okay.
But we have some, if somebody has a symptom, they go get tested. They're feeling better. They're still waiting for the test result.
Right.
They're out
Right.
at that point until we get the
that
test
can
back.
happen.
Yeah.
But I just wanted to say that sometimes, even though they're negative, they still have to be out for a short time.
Yeah, that's right. I guess, and I think families, again, I care about the staffing implications. If you had flu going around and 5 people got the flu at Martha Jones and you're waiting a week, you shut down the school. You might have to shut down the school.
Well,
right.
Fingers crossed. Wouldn't, but those are the kinds of things that keep me up at night, right? I mean, it just has to do with like operationally, how do you continue to function?
But if people have the flu, they're not going to come back in 5 days, regardless of what in a regular year, if you have the flu, you're going to be out a week. So hopefully we're promoting that people get flu vaccines.
Right.
So I think that, so I'm struggling a little bit to understand exactly what Wellesley has done. I know that they had this sort of prioritization of what they wanted to do, but what exactly have they implemented? I know that they've got the Newton-Wellesley relationship. That's great. But what exactly have they implemented? And
I communicated with the superintendent today. So there's the Newton-Wellesley partnership, but in terms of, they're about to sign a contract, and what they have committed to is a one-time test for all students and staff. And my understanding is that the Wellesley Educational Foundation is putting up the money for that, which I think is about $250,000.
Up $250,000.
$250,000. So they're doing that.
1.5 million.
Yeah. So there's that one-time test, sort of baseline, and then access to weekly testing for staff, not students.
Not students.
That is my understanding.
And that's all paid for by the school.
No.
No, I know it came from the grant, but meaning these people aren't coming out of pocket, right?
The Wellesley Educational Foundation does it too,
That's the
250.
250. Right.
The survey of all the school parents, asking them what they're willing to pay. They pledged 750,000 so far from that group. So that's another chunk of the money to come up with the 1.5 million. And the contract is being signed this week to begin to do that testing.
What?
The contract is signed this week to test all the kids and all the teachers right away. One time. And secondly, to teach all the tested staff weekly for a couple of weeks.
Total is 1.5 million.
Right. And they're hoping then, if they can get more money, and depends on their what their positivity rate and all of that is, they may ultimately like to do some more testing of the kids. But that's outside the initial money, which is a pilot. And they've invited Westwood, as they've invited other towns. If we would like to join the pilot, at least to keep talking to them, because that's collaborative group gets together every week to talk about what all the different towns are doing, but they all have a commitment to do what Wellesley has just done, which is to basically test everybody once, the teacher, staff, and everybody for every week for a period, and to do all this initial, getting in touch with providers who can do a 24-hour test in volume because of the town. Now that's a model they have. If you want to join their model, they'd welcome us to join them with the other 8 towns that are doing it.
Okay. So I think that the partnership to me is a no-brainer if we can find it. It seems to me that's low-hanging fruit, right? We should absolutely try and find a partnership that will, and maybe the urgent care center at the Brigham and at University or Dedham Medical or even some private testing, local testing. I know that there are some around here. In terms of the testing, I mean, clearly, I think we should absolutely explore this more. I think it sounds like we're a little late to the party, but I think we had a lot going on. So I'm not, I'm not surprised. I think a lot of towns are probably where we are. And, but I think we should explore it more. I'm concerned of the cost, but if we can find, sort of private money, I think that would be money well spent. I just think
two of these cities and towns are paying for it out of their school budget. They've figured out a way. I think it's Cambridge is one of them, but they're the only 2 so far that are paying for it out of their school budget. The others are going for these different other methods you've mentioned.
Right. Okay. I mean, if we decide this is a priority, then we would have to look at our budget, right, and decide if there's room there. And
that's next on our agenda.
Right.
Yeah.
So maybe we, at this point, we've had a lot of good discussion. There's more work to be done. Tony and Charlie, thanks for giving us an update, more discussion to be had on this important issue, but I think we should move on. Good segue, Maya, budget and
I would
hiring.
just like the committee to say that Tony and I should keep in touch with the Wellesley group, keep informed of what they're doing, tell them that we may be interested at some time in the future to join them, but I think I'd like the school committee support that we continue this exploration with them and with the collaborative that they've set up.
Oh, I think absolutely.
Definitely.
Comment? Or I'm just wondering, I am in support of continuing the conversation. I was wondering if you wouldn't mind finding out from Wellesley about the testing they're using, if it is just establishing presence of COVID, meaning a student could have had it in July and recovered and no longer be contagious, or if it's actually evaluating the contagiousness, like the viral load and the cycle thresholds.
We'll learn a lot from them. We've already told them that we would like to. They did send us the RFP that they used to solicit the feedback, and they said they had some great companies coming in with great ideas. There's a couple of groups out there doing free testing to towns. If you submit your proposal to them, Ginkgo is supporting a whole bunch of communities for this initial testing if you get your application into them soon enough. But we've asked them, they said they couldn't tell us who they're choosing yet, but now that they've chosen somebody, I think we can learn a lot from them, the system that they've chosen, why they chose that system, and who's doing it.
Thank you both for doing all that work.
Yeah, thank you. Right, Richard. There's a lot to talk about in terms of types of testing and so forth. But I think we can talk about that again in our next meeting. So I think at this point, unless anyone objects, we're going to move on to our next item, which is budget and hiring update, right?
Yes. Let me share my screen here.
Emily, before you start, are you guys all set with me?
Oh,
yes,
yes.
thank you, Jared. Thanks.
All
You
right, it
can
was
stick
nice.
around, Jared.
I say, you
I
don't want to
would-
stay for the budget update?
I
You're
would
missing
normally-
the best part. You
No-
saved the best for last, Jared.
I would just look at your giant budget and cry.
I'll say goodnight too to everybody.
Thank you, Karen.
Thanks,
Thank
Karen.
you. Thank you
Thanks.
both so
Karen.
much.
Thanks,
All
Karen,
right,
Jared.
thank you. It's nice
Okay,
to be
thank
with you.
you. Bye-bye.
Bye-bye.
Thanks. All right, so Lemma and I want to give you an update on hiring and the budget situation. And I know the hour is late, but I think we have a lot of important information, so I'm going to try to go through this quickly. So just want to remind you, we're in this budget landscape with many unknown variables, and what we were talking about in the spring, just to harken back, is that we were talking about some uncertainty with Chapter 70. However, the town has been wonderful about sort of assuring us that they would be able to backfill any gap in Chapter 70. And actually, the Chapter 70 picture is looking like relatively good at this point. So really what we're focused on is what we discussed in the spring, and that is that our operating budget includes about 1.5 million in federal funding, grants, and circuit breaker reimbursement, plus revenue from other revolving accounts that's included as offsets in our budget. And we, in the spring, talked about the fact that we had some concerns that some of this funding could be substantially decreased this year. And specifically, circuit breaker is something that we think we really need to keep our eye on. And unfortunately, at this point, we don't, in this moment, yet know what the circuit breaker reimbursement will be. So that's still a significant unknown. And of course, there are some unknown things about the revenue that would be generated through our revolving accounts in a disrupted year. So the other piece that we were talking about last spring, and that has certainly come to fruition, is that our costs have changed since the FY21 budget was developed as a result of this unprecedented situation that we're in the world. So we sort of have a budget that we built for a different landscape. And so, as you recall, last spring, we implemented a strategy, and that was that we implemented a hiring freeze, and we were really looking at the educational impact of not filling positions that are vacant due to retirements, resignations, non-renewals, or were newly proposed in the budget. And we decided that we would hire only those positions where the impact of not doing so was untenable. And we then created a master schedule and attempted to make teaching assignments based on those assumptions. We also said we would continue to make projections about the year's needs and costs by engaging in planning for various reopening scenarios and structures, and that we would work collaboratively with our bargaining units who were at the time in negotiations. And as you know, we did that, and we were very appreciative that the two bargaining units that we bargained with last spring agreed to take 0% increases for this year. So last spring at the school committee meeting, we first talked about it in May, and then I think in June, we approved some cuts from the FY21 budget. And so we had them in tiers. The first tier, tier 1, was to cut 8 FTE, full-time equivalent, professional positions, and 2.5 FTE paraprofessionals, instructional assistants. The second tier was to cut 3 FTE teaching positions. Tier 2 was all 3 of those FTEs were elementary classroom teaching positions. And so the impact of these cuts, tier 1 and 2 combined, was about $1 million. And we basically said we think we need to carve out about $1 million in the budget so that we are able to respond to potential decreases in revenue and increased costs. So I want to tell you what has happened. Of course, at the time that we were having those discussions in the spring, we didn't have guidance from DESE yet about reopening. And we had not yet begun the process of planning for the fall reopening model. And that clearly was, a process that evolved over a period of a couple of months. But as it turned out, all of the tier 1 cuts were implemented. And I just want to show you what those cuts ended up being. So it's 8 FTE professional positions and 2.5 FTE instructional assistants. And you can see here in the screen what the actual cuts were. And of course, at this point, we have some real dollars associated with those particular positions. So the savings, if you will, from making the tier 1 cuts was $738,543. And this was in the ballpark of what we had estimated when we proposed the tier 1 cuts. So that was pretty straightforward. However, this is where things started to get complicated. So we were not able to implement the elementary classroom teaching cuts at tier 2. And so here is where sort of the evolving fall reopening plan and what ultimately ended up being the hybrid model required us to really look closely at our staffing situation. So in the FY21 approved budget, we had budgeted for 66 elementary classroom teachers, gen ed teachers. In the spring, we proposed cutting 3 of those positions, and we had sort of a class section chart, and we said that we would reduce to 63 elementary classroom sections. It actually was 62 sections plus a co-teacher at Deerfield, but it was 63 FTEs. In actuality, as we have opened this fall, we are opening with 75 elementary classroom teachers. And this is due to a couple of things. So some, but not a lot, has to do with an enrollment increase at Deerfield in singletons. So we had at Deerfield singletons in grades 2 and 3 in the spring, and the enrollment in those singleton sections grew, and they grew to a point that it was not tenable to remain singleton. So I believe one got up to about 29, and we felt that we had to split those sections. The significant impact, though, has to do with the model that we decided to implement. And as you know from our prior meetings over the summer and our discussions, we felt it was very important to prioritize in-person learning for our youngest learners for pre-K, K, and 1. And in order to do that, we had to create many more kindergarten and grade 1 sections than we had planned for, so that we could keep the cohort sizes where they needed to be. And then the other factor here was the number of students who opted for fully remote in K1 and 2. And as you know, we now have at each of those grade levels 1 fully remote class with their own teacher. And so we had to find a way to staff these 9 additional elementary classroom teacher positions. And we really used 3 strategies to do this. So the first strategy was to reallocate staff that was in the budget from other areas. So from librarians, who also are licensed elementary teachers. So library, math specialists, and literacy specialists. And basically, we have taken these very skilled individuals and moved them from those specialist positions and put them into gen ed classrooms for this year. It is absolutely our intention that we would return those folks to their specialist positions next year, assuming that we are not in a similar situation. So that was where we got 4.5 FTEs. And so from a budget perspective, these are cost neutral because they were budgeted positions. It's just that people are doing different roles. So it's cost neutral. There isn't an impact on the budget. I will say there certainly is an impact in the sense that some of the services that those folks would have been providing normally, we've decided that we are going to prioritize having them in the classroom And that was a tough decision to make, but given the unique circumstances of this year, we felt like it was the right decision for the short term. The second strategy is that as we created all of these additional kindergarten classrooms, the size of those classes, of course, was quite small, ranging between 10 and 14 kids. And so we decided that we would eliminate the kindergarten assistants who are typically in there in larger kindergartens. That resulted in a savings of $218,000. And then we used that money and created 4.0 teaching positions. And that was I think, $219,000. So it was virtually cost neutral to make that decision. And then that left 0.5 FTE. And for that remaining 0.5, we needed to apply turnover savings. And that was $48,839. In addition to these additional elementary classroom teachers, we added one full-time preschool teacher in order to offer in-person instruction in 4- and 5-day programs. And again, we had to apply turnover savings in order to add that position. So I want to talk a little bit about turnover savings because I think it's an important part of the budget picture. And so, as you know, turnover savings, which is sort of the difference between the budgeted salary, and then if that person leaves and we hire somebody else for that same position, if there's a differential between the amount that we budgeted and the new actual salary, we call that turnover. And turnover works in both directions. So sometimes you save money in turnover and sometimes you don't. Sometimes it's more expensive, but usually it results in savings. So it's really important for two reasons. Turnover is a very important tool in a school budget because it provides much needed flexibility to deal with unanticipated costs that come up during a given fiscal year. So for example, if we have somebody who goes out on a paid medical leave for an extended period of time, that wouldn't be in the budget. That's the kind of thing that you would have to rely on turnover. We might have changes in special education where we suddenly have to provide more services. That's something that you could apply turnover to. Turnover is also important because it's a foundation for the following year's budget. So, one of the first things that we do in the budget development process is we calculate the cost of level services, and we have to account for our contractual salary increases. And so if you have a clear understanding of what your turnover number is, then that kind of provides you with this start on covering some of those, level service cost increases. So it's important to look at it for two reasons. But because these are two fairly distinct purposes, you have to think about turnover in more than one category. So there's different kinds of turnover. So we have turnover that's due to retirements or resignations or non-renewals. And so that's turnover that can be carried forward into the FY22 budget development, right? Because that's turnover that we realize because someone has departed and they won't be returning. And so that goes forward. But then there's also turnover that's related to leaves of absence. So we might have someone who is on an unpaid leave of absence for the year. Their replacement is hired. You realize some turnover, but in the budgeting process, we have to budget for the employee who's on leave to return. So that's a different kind of turnover. It's helpful, it's very helpful. It's helpful in the current year's budget. And so I'm sharing with you here our turnover savings for this year. And this is actually a very interesting turnover picture. So you can see the first category that could be carried forward is $248,000 and change. The turnover from LOAs is a little over $330,000 for a total of about $649,000. I should note that the turnover that I mentioned that we applied to the 1.5 FTE teaching positions has already been deducted. So that's already accounted for in this number. What's interesting about this turnover is that the turnover due to leaves of absence Most of that are for leaves that were requested during the summer and are unique to this year's circumstances. So we had many, many more teachers take leaves this year than we would in a normal year. And so, you know, at some level, operationally, that's not positive, right? It's quite disruptive, actually. But it turns out financially, that is actually providing us some important savings this year, because many of the folks who are on leaves have higher salaries than the people that we hired in behind them. So that's notable. It's about 19 leaves, I think, and about 15 of them are clearly related to the pandemic. So that's some revenue that we can factor in there, the turnover savings. And then we have some other revenue that we've talked about before. So through the coronavirus reopening funds from the state, that's $225 per student and a little bit from the CARES Act. We got about 20K from that. The total additional revenue that we didn't know we were going to get back in the spring is $690,000. And then we're mentioning here, because we think this is important, we also are keeping track that in the town's special ed reserve account, we currently have $558,000. So those two things are some good news. But now I'm turning it over to Lemma for the bad news, however, so that we get a sense of the picture. So Lemma,
Look at you, Emily. You give all the good news and leave Lemma.
Right, I like to give the, no, I'll turn it over.
I'll take it. Great. So I think Emily did a great job of laying out some sources of funding. And those, again, to summarize, were places where we've carved out funding within the budget through budget cuts and through turnover. And she's also named that there are some external sources of funding, the coronavirus funds, the CARES Act, and the town special ed reserve. In terms of uses of funding, before I go into what we anticipate this year, I just want to name that in this, and remind people that in the spring, we had some deficits that we absorbed, and we got help from the town in absorbing some of these costs. And these were in some of our revenue-based services. So we had a deficit in extended day because the revenue didn't cover costs in the spring when we retained staff. And we also had a deficit in food service, again, because when we closed, our revenues did not cover our staff costs there. We've taken some measures this year to reduce that uncertainty and reduce the risk. So one of those measures was to close the extended day program in the fall, and we anticipate, we anticipated that the revenue there wouldn't cover costs, and we saw some health risks as well in operating that on our sites. The other step that we took is we reduced our food service positions. So our staff reduction there was from 20 positions down to 9. We think that puts us in a better place. But there are some risks that remain on the revenue side specifically, and food service is still one of them. So I want to say that risk in previous iterations would have been much higher, but now I'm estimating that there's a food service risk currently between 150 and 200K, and we will be looking at this very closely over the coming weeks. What we're seeing is that so far, food sales have been very slow, but we recognize this is only the second day of school, or only some of our students have been first week of school, 2 people, second day for some kids, first day for others, and we're still at the beginning here. Families are getting used to the new ordering systems and to the fact that lunch is now being served in elementary classrooms. We're hoping that sales will increase, but we'll have to monitor those numbers, and if they don't increase, then that would be something we return to evaluate more carefully. There's also the bus fees offset. So we charge bus fees, and we use those bus fees to cover some of our transportation expenses. It is in this year an area where we see a risk of about 107K. That's the difference between what we collected last year in bus fees and what we've collected in this year in bus fees. And so we'll need to absorb that cost. There's a ridership drop from 1,580 students last year down to 690 at the moment in our buses, and that was a response to a call that we made to have families consider other options, including walking and carpooling, so that we could allow for physical distancing and safety measures on our buses. But there's a cost associated with that. We have declined for the time being all external building use. And we do have a position, a salary that is funded on building use. Since we're not generating revenue in that account, we anticipate a risk of 62K there. And finally, we estimate at least 200K. The circuit breaker risk is a little bit unknown. We have limited insight into what the circuit breaker reimbursement will be. But we realize that it could be much lower than in prior years. And we've budgeted for, I believe, a $790,000 circuit breaker offset. So some of that will come in. We've been assured it won't all be gone, but there very well could be a reduction in what we get for circuit breaker funding this year. So that's a highlight of the revenue uncertainty so far.
Lama, can I just jump in here? I'm sorry, this is a typo on the slide that's very important. The circuit breaker risk should say 500.
Okay.
So that is a typo on my part, but the 500 is reflected in the later numbers.
So,
great, thank you. So
do you want to wait till the end? Can I ask a question specifically here?
We could pause.
Yeah, so I just want to understand, so risk versus we know it's going to hit. So for example, it looks like the bus part, look, we know how many bus people are doing the buses, we're going to lose 107,000. Assuming that's just, we're going to lose it, which might be different than a risk, which the food services, if we don't get more kids, I'm just saying, if we don't get usage at more meals, we could say, well, you know, we're going to go take staff from 20 to something else, or 9 to something else. I guess are some of these, how many, I guess, are all 4 of these risks, or some of them, like the bus fees, is that basically what we know is going to happen?
I'd say the bus fees is a little bit more solid, although we have had registrations up until yesterday. So some families continue to register, and we'll be working with those families to make sure that they've paid their bus fees and all of that. So some follow up on that.
Well, maybe ask a bit on the bus one. Is there capacity? What's the capacity on the buses?
Capacity is 24, 25 students per bus. We are well under that capacity now.
Okay.
We've halved our ridership, first of all, but also we have this hybrid model where students aren't on the bus every day necessarily. Some of course, the 4-day students are riding 4 days a week, but the others are only riding 2 days a week. And so there's a good deal of capacity if we do have more needs, or if more people want to sign up for the bus. We're just balancing that and thinking about safety and distance.
Yeah, right. No, well, I guess if there's capacity within the constraints of COVID of 24, it might just be good to communicate, you know, we're only at, you know, I don't know, you might be able to communicate there's more capacity. It's just.
Yeah.
Can I just want to add, Tony, because I think you're making a really important point, right? So that there are other things here like food services and building use. I mean, we're estimating risk there. And to your point, we can monitor them and we might be able to make some choices around those things, right? If we have to, depending on how it trends. Whereas circuit breaker is a risk that I think is a significant unknown, and there's nothing we can do but wait, you know, and find out what happens. And so, yeah, I mean, it's a different kind of risk for some of these.
Thank you, Lana.
No problem. Okay, so that was revenue. We do have some expenses as well. So this is a summary of our expenses to date. So first, I'd like to say that we've spent about $900,000 so far in technology, software applications, PPE, ventilation, and other equipment costs associated with reopening. So this is a broad range of categories, and some of these expenses we've discussed at the school committee. We know we talked about the iPads that we were purchasing at the younger grades. We've talked about enhanced membership with Zoom, certainly the PPE that is absolutely critical for operating, some filters and other ventilation measures that we've taken, and equipment costs is a pretty big category here, but it's everything from some medical tents to bigger waste barrels. So all kinds of things that we needed to reopen. Some of these things are one-time costs, others will repeat. And then there's a $120K that is also, that hasn't been paid out yet, but it's really like a committed expense there. And that's also in the area of ventilation primarily. So once those services are fully delivered, like once the filters that we've been waiting on arrive, those bills will be paid. So those are expenses to date. We also have anticipated expenses and some other potential risks that I'd like to name. So first, my estimate for continuing PPE and ventilation costs is approximately $750K. It is hard to be very firm on this number yet, because there's so much that's unknown about how we'll be operating for the remainder of the year, and also our rate of usage on PPE. So it's been a few days of school now. We're monitoring already the rates of usage. Some schools are reporting to me that they're getting low in their PPE inventory. Others are doing well. We're watching that closely and developing our tracking mechanisms so that we can always have additional inventory on hand to carry us for several weeks.
Lemma, can I just ask a question there? And so you, in terms of money that we've already spent on PPE, how many weeks would you say we have purchased for?
So the plan, so some of that is a question of usage, right? I'm learning. But we had purchased for about 6 weeks to have inventory for 6 weeks worth of school at all times. And we're monitoring to see, is that still true? And if it's not true, then we're quickly re-upping so that we always have that, like 6 weeks worth of PPE that's on hand at all times.
Yeah, okay, thanks.
We are seeing that the supply chain is not too bad here in most areas. There are a few things that are still really hard to get, like the true N95 masks are very hard to get, but almost everything else is now we're able to procure. We can get KN95s and we can get masks and get gloves and other things relatively quickly, so that's good news. I'm naming here also that there are potential special education compensatory services. It's hard to put a number on this, but so far I'm saying 250K based on what I've heard from Abby, and we're really like shooting in the dark. We need to wait to see how things play out here, but we recognize that some student services weren't fully implemented in the spring, and we need to be aware of that. We need to monitor that as we move forward. And then additional staffing to support grades 2 and 3. So here I can let Emily support, but we're recognizing that in the first 2 weeks of school, grades 2 and 3 we're observing may require more support. So there may be a staffing need there specifically, and that could be a cost of 150K.
Yeah, I mean, it's very early right now, but I have to say, I've had some conversations with teachers and, not necessarily unexpectedly, for grades 2 and 3, sort of the youngest kids who are in this hybrid model using technology, there's some challenges associated with that. And, so we want to take a few more days and sort of think carefully about this, but I think that we may need to provide some additional staff. And frankly, we have some third grades that are pretty large. So I think that I would be coming to the school committee and suggesting that we needed some additional staff to support those classes, even if we were fully in person. So, it was important to us to let the dust settle and really be able to take a look at that turnover number and try to assess our financial picture before thinking about what else we might add. And just because of the timeline and rhythm of hiring this year, which is so different, we're just sort of getting a handle on this number. But I think that this is something I'll want to talk to the school committee about relatively soon.
So finally, there's just a summary here of our available funds. So these are the funds that we were able to carve out through our budget cuts, turnover, as well as external funds, the reopening and CARES funds, and the special ed reserve account. That is about 2.5 million. We've named about 670,000 in uncertain revenue that we have to watch in the next few weeks and months. And then the COVID costs that have been incurred or committed are a little bit over 1 million. And we anticipate the sum of the future costs would be also a little bit over 1 million, 1.15 there. So far, what I'm seeing is a potential shortfall of over 400, almost $500,000. This is an operating budget shortfall. We have to monitor in the coming weeks to see what happens with circuit breaker and whether we'll be able to, if there's good news in circuit breaker, that would help us absorb this shortfall. Otherwise, we're just going to have to monitor to see where else can we find funding within our operating budget to absorb these costs or hopefully we find revenue from other sources. So we're waiting to see if there's any other news from the federal government on revenue that might come to municipalities and school systems. We are watching to see, we're always in communication with the town to see whether there are opportunities for us to work with the town to get support for any needs. I would say that I've been working closely with the town to make sure that we claim expenses for PPE and other like cleaning measures that are claimable under FEMA. And that's really great news that we've been following up on that. And I really appreciate the work that the town has been doing to support me in those claims. But one concern about that is that FEMA reimbursement usually doesn't come in a timely way. So we can't count on that in this operating budget cycle. And it might be a lagging reimbursement. So that's one of those downsides.
And when do we expect to hear about the circuit breaker?
Good question.
I haven't gotten any hints about that lately, and either in my my network of school business officials or from DESE, I have not heard anything.
I can tell you that on the weekly calls that superintendents have with the commissioner, and every week somebody says, "What's the word on circuit breaker? What's happening on circuit breaker?" I think everyone is waiting to hear this. And I think as Lemma and I put this together for you, we want to make sure that we are realistic about some things that we think might happen. So we don't think we're being overly dramatic about some of these potential risks. But, we also want to be clear that, for instance, this shortfall is based on a $500,000 cut in circuit breaker. And we may get much better news than that about circuit breaker. And so, fingers crossed, if there weren't a cut in circuit breaker, then this potential shortfall would be taken care of, right? But we just feel like it's important to kind of be clear-eyed and keep all these things on the horizon so that we can monitor things carefully and make decisions as we go along. We've submitted our circuit breaker claim, correct, Abby?
We claim the heck out of it, let me tell you. It's quite a claim. And we have survived their initial auditing process, and that claim is validated, finalized, and in. And the silence is deafening on the when we will hear. Certainly on my side of that conversation, we are not hearing when the percentage will be public. And as soon as it is, we'll let you know. Yeah. It's almost October.
Yeah. So that's clearly a big one. Obviously from my perspective, in terms of making decisions about additional grade 2 and 3 staffing, which I think may be very important and something we need to do, it would be really helpful to have some of this other information on the revenue side to make that decision. But we may not have it before it's time to make some choices.
I have a question about where things stand with the math and literacy specialists. You mentioned there were positions cut at the beginning of the presentation.
Yeah.
How many positions were cut and how many specialists are we left with, and how is that impacting the students?
Yeah, so we reallocated, I think, so there's one librarian, so 3.5 between math and literacy, so total went into the classroom. And these are folks who are very, very skilled, right? And so we think, for instance, having a literacy specialist teach a first grade is like a big win. Educationally, it's wonderful. But to your point, those are folks who would be doing intervention services and also coaching. And frankly, last year when we were remote, did a great deal of curriculum development and support for teachers. So we really have been aware of that. And we did hire in behind one of the lit specialists. Allison, do you happen to know sort of what the remaining FTE is?
Well, I'm trying to think if I can put it together off the top of my head. What I will say is we've sort of shifted the model to be more of a district-wide model instead of a building-based model. So in order to make sure we don't have any gaps, the literacy specialists and the math specialists are working across grade level bands so that we really focus in on each grade level. So they're really deploying all through grade 1 to do both, for example, to do both their coaching and intervention support. So they'll really kind of get to know that grade level and work. I think we've kind of figured out a way to do it even with reduced staff, but the impact ultimately on the staffing was in literacy. We're down like 1.0, I think, for literacy, and maybe 0.5 for math. So it's not that bad.
Thank you.
So, I mean, overall, honestly, this isn't as bad as I thought it might be. So, I mean, so I guess, my view, there's one thing here that is actually has, well, there might be more than one, but one that clearly has educational value. I would be supportive as quickly as possible, even ahead of the next school committee meeting, moving forward on the second and third grade staffing. I know there's some uncertainty, but I think there's some manageable risks that we might be able to do some things on. I think that's the one thing I'm hearing. I think we've done a great job on the K-1 with the 4 days and obviously in the small classes. That's the one thing here that actually could move the needle, I think, educationally. I mean, there's probably some other things, but a lot of this other stuff like PPE, I know we have to do, but it's not. So I'm very supportive of that. And at the appropriate time, even before the next meeting, I would support it. So that's my view.
Okay. Yeah, thanks. I mean, we've had a lot of discussions about like that this summer where, we're sitting around talking about whether or not we should do something and thinking about the cost and where does it come from. And then we kind of get to like, we have to, it's a priority. It's really important for kids. And so we just do it. And yeah, that's how I'm feeling about the grade 2 and 3 staffing as well.
Yeah, and I can second that. I mean, I would say that the budget that we've been discussing today has been, we have been managing it very tightly so that we don't overrun expenses in ways that aren't wise. So we made the right purchases, I think. We made the investments in ventilation and PPE and in technology that we needed to make, but we also have been conscious of the costs because we recognize we have a charge to work within our operating budget, and when we don't, that places a significant burden on the town.
Emily, as far as one of the potential sources of monies to pay for testing of the teachers and the students one time and teachers later, quite a few towns are using the CARE Act for funding that. That's $690,000 in our budget. That's the other thing is.
I just want to clarify, Charlie, that is not. We got $20,000 from the CARES Act to the school department.
Okay, I'm sorry, it said 690.
It was a combination.
Yeah.
So we actually, a lot of towns and school systems have benefited from CARES funding specifically, and it was a larger pool for them. In our case, it was $20,000 for the town of Westwood. We did $225 per student through the coronavirus reopening fund, and that was the bulk of the 690. So that was 675 that came in through that other funding source. We added those two up, the 20,000, the 675. That was where,
that's how we got that. But yeah, so
the 20,000 actually that I mentioned, sorry, for CARES Act is really 15 for Westwood, for the Westwood Public Schools, and 5 for the variant. So this is why we got to the 690 number.
Yeah.
Thank you.
So there were communities that got significantly more than that, Charlie. It was tied to the Title I formula.
Mm-hmm. So is this summary something that we're going to see updated each month?
Well, I can say one thing. It's traditional for us in October to have the Q1 report, and I think there's some overlap. So as part of the Q1 report, we can comment on COVID expenses, but it will also be a summary of what's hit our budget at that point in time.
Yeah, I mean, I don't think we need this level of detail, but there's so much in here that's unknown at this point that might be known this month, next month, or the month after, that I'd be interested to see how these numbers are shifting each month. And I know, maybe just taking this summary and updating the numbers without having to go through all of the background that you gave us, which we now have.
Yeah, I mean, we are obviously going to be keeping a very close eye on these numbers.
Yeah, I mean, and some of these things, again, I know there's things we have to do on food services for some children that need to provide lunch, but let's cut bait. If people don't want to order, to go met food at 1 o'clock, like some of these things we should just cut bait and try to get, to me, in my view at least, do what we need to do, but kind of cut to the cost so we can invest in some of the other things like the grade 2 and 3.
Mm-hmm. Yep. All right.
Okay. Well, thank you for that update.
Thank you.
All right, we're going to move on to action items. And we're going to start with the August 27th, 2020 meeting minutes. Can I get a motion to approve those minutes?
So moved.
Second.
Thank you. Any discussion on the minutes? Any changes, concerns? Nothing? Okay, then let's take a vote. Maya,
Yes.
Charlie,
Yes.
Amanda,
Yes.
Tony,
Yes.
and I'm a yes. So unanimous, motion carries. Moving on. Motion to approve the September 1st, 2020 meeting minutes. Can I get a motion?
So moved.
Second. Okay, thank you. Any discussion on these minutes? Seeing none, let's take a vote on the minutes. Maya,
Yes.
Charlie,
Yes.
Amanda,
Yes.
Tony,
Yes.
and I'm a yes. Unanimous, motion carries. Everybody looks like they're wilting. Any new business out there?
Sorry, I do have one small thing. I know it's probably the last thing on the superintendent's mind, but and it's probably not been a high priority, but a discussion of goals maybe at the next meeting. I know it's a weird year.
Survival? No.
Survival, yeah.
Yes. No, I have thought about that. Yep. I will do that.
And I know it's a strange year, but I think it would still be helpful to talk about it.
Okay. Anything else? Nope. Okay, let's get a motion to adjourn.
So moved.
Second. Okay. In favor, Maya,
Yes.
Amanda,
Yes.
Charlie,
Yes.
Tony,
Yes.
Carol, yes. Okay. We are adjourned, people.